Alright, so first I'll demonstrate the Ottawa ankle rules, which warrant an x-ray if you have pain in the malleolar or midfoot area with any of the following: the inability to weight bear for 4 steps after the injury, tenderness along the distal 6 centimeters of the tibia or medial malleolus, as well as the distal 6 centimeters of the fibula or tip of the lateral malleolus, the base of the 5th metatarsal, and the navicular bone. So now I'll demonstrate the test item cluster for patients who would benefit from spinal stabilization exercises. The first one is age under 40. The next is straight leg raise over 91 degrees. Okay. The next is a positive prone instability test. Any pain? Lift your legs. Any pain? Okay. And the last one is aberrant movement. So go ahead and try to touch your toes and then stand back up. Good. I'll demonstrate the test item cluster for patients who would benefit from spinal manipulations. The first is acute onset of less than 16 days. The next is an FABQ work subscale score of 18 or less. The next is no symptoms distal to the knee, at least one hypomobile segment, and at least 35 degrees of hip internal rotation. Go ahead and flare your leg out. Good. I'll demonstrate McMurray's test to test for the presence of a meniscal lesion. I'll now do the anterior drawer test to test the integrity of the ACL. Alright, so I'll demonstrate the slump test to test for neural tension. So I'll have you go ahead and bend your head forward and shoulders. Okay, apply overpressure. Can you extend this knee for me? Good. Those are your symptoms?
Yes.
Okay, go ahead and sit up. Does that relieve your symptoms?
Yep.
So I'll be demonstrating one of the test item clusters for hip osteoarthritis. The first one is hip pain. The next is hip internal rotation less than 15 degrees. Go ahead and flare your leg out. Okay. And the last is having hip flexion less than 115 degrees. Go ahead and flex your hip. Okay. So now I'll demonstrate the calf squeeze test, which is to test for Achilles tendon ruptures or tears. I'll now demonstrate the Faber test to test for the presence of hip pathology. Alright, so now I'll demonstrate the difference between glute hamstring weakness and an L5-S1 radiculopathy. First, the glute hamstring weakness is going to be localized, so you're going to have weakness in hip extension, hip abduction, hip external rotation, and knee flexion. You'll have normal reflexes and normal sensation. And then for the L5-S1 radiculopathy, you're going to have numbness and tingling throughout the L5 and S1 dermatomes, as well as a diminished S1 reflex. And then you'll have diffused weakness throughout the leg, especially in plantar flexion and big toe extension.